Before this project, system thinking was a foreign concept to most of us. Through individual explorations of various units in terms of purpose, patients, providers, patterns, and processes, we have decided what systems thinking means and what impact it has on our nursing practice. Systems thinking is the process of looking at each piece of the whole to determine what is affecting the way in which the system is performing. By understanding each component of the system, nurses can better find the root of the error. It is also helping to determine what is working for the system. This knowledge can guide the change efforts to better overcome the hurdles and not just create quick fixes. Not only that, but they can use what is working well to inspire changes that will work in other parts of the system. In the following presentation, we have created scenarios to demonstrate the 5 Ps.
Come in.
Hi, Megan.
Yeah.
Hi, my name is Jordan. I'm a nurse in this unit, but right now we're doing a patient satisfaction survey. Is it okay if I ask you a couple questions?
Sure.
Okay, great. All right, so how has your experience on the unit been so far?
Well, the food isn't very appealing.
Mm-hmm.
And sometimes I feel like the physicians don't listen to me, and sometimes I feel like they're rushed when they're talking to me.
Okay, yeah, that's, the physicians are pretty busy during rounds in the morning, and during the day as well. So, if you feel like you have any questions that that haven't been answered when they're rounding, please bring them to the attention of your nurse and we'll get those answered for you. Have you had any positive experiences, not just with your hospital stay now, but overall in the clinics and everything?
The nursing staff has been awesome.
Mm-hmm.
They've been really respectful of my religious beliefs.
Okay.
Some hospitals I've been to, they don't really respect my need to fast on Fridays during Lent. So it's really comforting to know that the healthcare team here respects my beliefs and that they're very supportive of that.
Good.
And overall, the nursing staff has been wonderful,
Mm-hmm.
and I really do enjoy the new portal system and having access to that because I'm able to check my labs, and if I need to ask a question, I know that I'll get a pretty quick response.
Okay, good. Yeah, we really do at this hospital stress cultural competency, and that doesn't mean just like foreign countries. It means is just different religious beliefs and cultural preferences in our country as well. And the portal, I agree, it's so much easier. It's just easy to get a response from your doctor really fast. So do you have any other questions for me right now while I'm here?
I don't think so.
Okay, well, have a good day, Megan. It was very nice to meet you. Thank you. Patients are a huge part of the healthcare system. Taking the suggestions to improve the quality of healthcare they receive is very important. Also ensuring that medical professionals within the healthcare system are competent in cultural and religious beliefs that patients may possess is vital to ensure patient-centered care. Not only acknowledging cultural beliefs, but ensuring that they are respected and allowing for patients to practice their beliefs is important for patients to feel like they have a say in their care and the healthcare system.
Sorry I'm late. The nurse who took over this morning ran into some traffic. How have you been? I feel like I haven't seen you in ages.
Yeah, well, ever since I started in radiology, I've gotten to spend a lot of time with my kid. Mary just started playing soccer and also just started playing the tuba, so I've been driving her and her friend around a lot to their different things in the new Previa.
Oh wow, I can't believe Mary's getting so old. It must be nice to have all your weekends free. Sometimes I think about transferring to the outpatient clinic just for the hours.
Yeah, I mean, radiology is nice, like, for those reasons, but it also has its drawbacks. I mean, there's a lot of inbounding patients, so lots of documentation. That's like most of the work. Procedural is nice because you get a little bit more of your med passing and patient assessment, but I still don't feel like I'm really reaching the scope of my practice. Cardiac had a lot more work, and as weird as it sounds, I kind of miss that.
Yeah, I totally get that. We're doing this exciting process where we're getting our nurses to pull chest tubes, just like the nurses on the thoracic floor, and it's really fun, but I'm nervous it's going to cut our patient interactions.
Yeah, I totally understand. I mean, making those connections with patients is kind of a big deal for nursing. I don't think I'd be able to do the medical side because missing out on that patient interaction aspect of care just wouldn't seem right.
Yeah, sometimes it can be so frustrating though. This morning I was trying to get my patient's over in, and no matter how many times I called the physician, he just wasn't able to put the order in, and finally he put it through, and then when I went to places, it wasn't even stuffed. So I had to call the pharmacy, and by the time they got it up to us, my patient had already vomited all over their sheets twice. I felt like I'd really failed the patient.
Sounds like you had a lot going against you. I think the physician might have benefited from having like a PA or nurse practitioner work with them. And also, like, it seems kind of weird that Ixis wasn't stocked with such a common medication. Kind of makes you think what was going on in the pharmacy, or like why there was so much nausea on your floor.
Yeah, totally. I think a physician let his NP go on vacation this week, and he's really struggling to stay on top of his caseload.
This scenario demonstrates many parts of the system that represents its professionals. It is important for the nurse to consider how each provider fits together with and how challenges can affect patient cares when looking at how providers affect the system. Nurses must fully understand their scope of practice and communicate effectively to meet their patients' needs.
Hey Maggie, how's your day today?
You know, it's not doing so good. My patient is newly diagnosed with diabetes, but the physician hasn't ordered anything in case they go into a hypoglycemic state. What do you think I should do?
Did you know that nurses can actually initiate the hypoglycemic protocol? We don't need a physician order.
Wow, that's really cool! Protocols are created to keep patients safe. It is an important part of nursing care. They are put in place to assist the nurse, not hinder the care they provide.
Processes are the how of healthcare. They set protocols which nurses can use when they ask, now what?
Because of the multidisciplinary nature of healthcare, the process does not always go as easily as the nurse would want it to. Most of the time, nursing and the patients are waiting for other disciplines to relay their information.
Our daily plan and processes are changing constantly to fit the schedule and timing of other disciplines. The process of healthcare is meant to keep patient safety at the forefront of the multidisciplinary team's focus. While the processes don't always go as planned, the protocols and nursing standards put in place help to aid the process and overall patient safety goals.
Hey Shannon, how's it going today?
Good, how are you?
Good. I wanted to talk to you about something. So I had this idea. I've started to notice this pattern where patients are coming into radiology every day and they just had all these labs taken, and not only are their labs often not back, but we also have to poke them again to get another IV started when they already had to be poked for a blood draw. I think that maybe this is something we need to look at changing.
Yeah, I agree. That's really unfortunate that they have to be poked so much, but at least we're asking them if they still need their IV in after they leave radiology for other appointments.
That's true. I think it's really good that the system, in that way has seen that a change needs to happen, and they're really working to change the structure of the system to benefit the quality of care of the patients. I think we should keep working on changing the protocol, though.
Yeah, I agree. We've been seeing this pattern for quite some time now, and I think the patients would really benefit from not having to be poked as frequently.
Not only would the patients benefit from not being poked as frequently, but I also think it would help the hospital. Like, maybe they could save some money and not have to use as many supplies, and could be really beneficial.
Yeah, I completely agree. I think it's a good thing that we're looking at the long-term consequences and the benefits as well, and understand how all of these actions and patterns affect patient care. Let's go and see what we can do to make a change.
Yeah, maybe there's something that we can do now.
Pattern recognition is an important component of the healthcare system. Nurses need to be knowledgeable about patterns in care and acknowledge the weaknesses and strengths that may be associated in order to promote change and the best care for their patients.
To be prepared to send you home, there are a few things that we need to go over. It is important that you adhere to these to prevent any further complications with your heart failure. What do you remember about what we talked about in terms of your DASH diet?
I just remember I can't have more than 2,000 milligrams of salt per day, so take the salt shaker off the table.
Good. That is a great way to avoid adding salt to your meals. I highlighted other tips in the packet that I'm sending home with you.
Okay.
Knock knock!
Come in.
Hi, Miss Safroni.
Hi.
I took a look at your labs and the echo looked good. These past few days have showed us that diet and exercise is the best treatment option as of right now. I think we will send you home on the medications you need and the education about the diet and exercise program for you. Do you have any questions for me?
No, thanks, Dr. Meyer. Why am I not going to get surgery? I feel like she doesn't care about what my needs are. Isn't surgery the best treatment? My neighbor had one and she never had to go back to the hospital again.
Well, your case is different than theirs. Some patients need surgery, but for you right now, lifestyle modification will be the best way to control your heart failure. So surgery can be expensive, and complications could also occur that could increase your cost of care overall, which we don't want. It is important that we give you the highest quality of care at the lowest cost for both you and the system. Does this make a little bit more sense?
Yes, thank you. I'm sorry. I only really focus on what I need and not what the hospital needs.
You're welcome. Now let's schedule you for a follow-up appointment with your primary care provider. This scenario shows the many purposes of the healthcare system. One purpose is to promote healing and well-being of the patients while preventing complications. Preventative education is one way to promote the system purpose, while unnecessary readmission seems like a failure in meeting this purpose. Readmission also impacts the cost of healthcare for the system, affecting the additional purpose of saving money. Also demonstrated in this scenario is how important it is for the nurse to help reassure patients they are receiving the best care for them as an individual.
When breaking down the components of the system, it is clear to see how systems thinking can impact the quality of nursing care. When it comes to patients in the healthcare system, it is important for providers to be respectful of cultural and spiritual beliefs to ensure patient-centered care and establish patient trust and rapport. It is also important to listen to patients voice their opinion about their hospital experience and what their concerns are in order to provide the best quality care. Nurses have to display systems thinking to properly meet patient goals and outcomes while ensuring that they are practicing cultural competence and patient-centered care. Truly understanding the needs of patients improves nursing care, keeps patients happy, and our healthcare system can continue to improve to meet patients' needs.
Professionals can impact the quality of nursing care depending on their ability to perform their tasks. Nurses are dependent on the pharmacy to stock the Pyxis and for other medication concerns. They are dependent on consultants and mid-level providers for certain orders, and they are also dependent on their nurse colleagues for help. All providers in a system must work together in order for the highest quality of nursing care to be delivered. High-quality nursing care is what allows nurses to find gratification from their job. The nurses we worked alongside across the board found that helping a patient was the best part of their job. These nurses face many challenges in the healthcare system amongst themselves, including staffing issues, job descriptions, and support. But nurses also find the positives when teamwork is applied. Systems thinking is important for nurses because there are many parts of the system that can affect each of the providers they work with. Expanding systems thinking amongst their colleagues will help nurses tackle barriers to providing high-quality care.
There are several processes used within the healthcare system. These processes aim to benefit the patients and the healthcare system as a whole by providing patients with safe and efficient healthcare. These processes can become quickly complex, involving many disciplines within several portals of information. To simplify the healthcare process, protocols and guidelines help to create standards. By utilizing standards in the healthcare process, both patient safety and the efficiency of care increases. Patients are safer because they can get the care they need quicker, and the shortened process increases the care efficiency. The nurses use processes throughout their entire workday. These processes can benefit and hinder care, depending on the complexity of the process, strength of interprofessional communication, and accessibility to resources. While there are negatives within the healthcare process, the ultimate goal is to promote patient safety and efficacy of care.
Healthcare professionals often use various patterns when it comes to the care they provide. In some cases, such as nurses, they create head-to-toe assessments to help them remember things to do. These patterns or routines are beneficial to patient care and can help prevent against patient harm. In some cases, patterns may indicate the need for change. For instance, in radiology, many patients go to get labs in the morning prior to the radiology appointment. However, the results are often not back in time and patients require a second stick. A proficient nurse may notice this pattern and implement a change in protocol in order to change the pattern so that patients' lab values are back when needed. Recognizing these patterns and contributes to the overall structure of the system and helps the nurse understand that the structure generates the behavior of the system. Thus, in order to see change, the structure of the pattern needs to change.
There are many purposes of the healthcare system, but the overall purpose of the system is to promote health and well-being for patients, and each unit within the system has their own purpose or mission statement. The goal is to prevent rehospitalizations and save the hospitals money because another purpose of the system is to financially maintain the hospitals. However, having the overarching purpose of preventative health and health promotions allows nursing professionals to meet patient outcomes. By using systems thinking, nurses can provide quality education interventions to promote proper healing of patients and prevent the return of patients to the hospital. By adhering to the overall purpose of the system, nurses have to provide quality and safe care so that all of the purposes of the healthcare system can be met and outcomes can be achieved.
In conclusion, systems thinking involves looking at each component of the system. Each component of the system impacts the quality of care nurses can provide. In terms of what is best for each patient, culturally competent, patient-centered care leads to the highest quality of outcomes. Systems thinking is necessary to determine what facilitates patient-centered care and what aspects, such as time constraints, are impairments. Professionals need to work together in order for a system to run smoothly. Nurses must understand what in a system is impacting their colleagues in order to facilitate smooth workflow. Processes within the system impact the quality of nursing care. If a process is too complex, it can hinder a nurse's work. Simplification within the system can promote safe and effective healthcare. Patterns within the system can illuminate necessary changes, that must be made to help facilitate care. When a pattern is causing lower quality of care, it is necessary to address the pattern's issues. The purpose of the healthcare system is to meet the needs of the patient. This cannot be done if the nurse is unaware of what is impacting the nursing care and the safety of their patients. Nurses must utilize systems thinking to reach high quality healthcare.